Right, the neck is the primary drainage basin for everything in the head and face. If there's an infection, or worse, cancer, the neck is where it gets caught.
And there's one node in particular that stood out. It has a name that sounds like something out of a Greek myth, the Delphian node.
Also known as Poirier's lymph node.
Where is this thing?
It's right in the midline, anteriorly. It sits just in front of the cricothyroid membrane, that little soft spot in the middle of your throat.
So why is it so special? Why does it get a cool name?
Because you shouldn't be able to feel it. It's very rare to find it enlarged. And if you do, if you find a palpable Delphian node, it is almost always a herald of bad news.
Like the Oracle of Delphi delivering a bad prophecy.
A very bad prophecy. It suggests a poor prognosis. It's often associated with glottic carcinoma or advanced tumors that have spread down into the subglottic region.
So if that one specific node pops up, it tells you the disease has already broken containment.
Essentially, yes. It's a big red flag waving right in the front of the neck.
And speaking of containment, the sources had some really interesting stats on metastasis cancer spread, depending on where in the larynx it starts.
This is a crucial distinction, yeah. The larynx has levels. You have the supraglottis, the upper part, and the glottis, which is the vocal cords themselves. If you have cancer in the supraglottis, the risk of it spreading to the neck nodes is very high, something like 60%.
Wow, more than half the time it's already on the move.
But if the cancer is on the vocal cords, in the glottis, the risk plummets. It's only about 10%.
60 versus 10%, why such a huge difference?
It all comes down to lymphatic drainage density. The vocal cords themselves have very, very sparse lymphatic vessels. The upper part, the supraglottis, is rich in them, so the highway for cancer to get out is just wide open up top.
So the anatomy dictates the behavior of the disease. Now, when doctors are feeling for these nodes, size matters, doesn't it? When does a doctor start to worry?
The general rule of thumb from our sources is a size cutoff. For most of the neck, any node you can feel that's bigger than 1 centimeter is significant. It needs a look.
Okay, 1 centimeter.
With one little exception, under the jaw and chin, the submandibular and submental areas, the cutoff is a bit higher, 1.5 centimeters.
Why the leniency there?
Because those nodes drain your mouth and teeth. They're constantly reacting to little things. Gingivitis, a canker sore, a cold. They're just reactive more often, so we give them a little more leeway.
Got it. Okay, to wrap this up, we have to talk about the zoning system. Surgeons use this standardized map of the neck, levels 1 through 7. Let's just do a quick visualization.
Sure, think of it as a grid that lays over the neck muscles. It's all about the boundaries.
Okay, level 1.
That's the chin and jaw area, submental and submandibular triangles. The boundaries are the digastric muscles and the hyoid bone. So a lump right under your chin, that's level 1.
Moving down, level 2.
Now we're on the side of the neck, along the big jugular vein. Level 2 is the upper jugular zone. It runs from the base of the skull down to the hyoid bone.
And level 3.
Just keep going down that vein, middle jugular, from the hyoid down to the cricoid cartilage.
And level 4.
Lower jugular, from the cricoid down to the collarbone. So levels 2, 3, and 4 are just this one vertical column along the major blood vessels.
Okay, that's the main vertical strip. What about the back?
That's level V, the posterior triangle. It's the area behind that big sternocleidomastoid muscle, but in front of the trapezius on your shoulder.
And then the very center, level 6.
The anterior compartment, the central column, right in front, between the carotid arteries, hyoid down to the sternal notch. This is where your thyroid lives, and where that Delphian node would be.
And finally, level 7.
Level 7 isn't really in the neck properly. It's the superior mediastinum, below the sternal notch, dipping into the chest cavity.
It's surprisingly organized when you lay it out like that.
It has to be. When a surgeon does a neck dissection for cancer, they need to know exactly which compartment they're clearing. You clear level 2, then 3. It's a systematic operation.
So tying this all together, we've gone from the vagus nerve splitting to these crazy loops around arteries to the zoning of lymph nodes. What's the takeaway?
I think it's about predictability and pattern recognition. The body is complex, but it follows rules. The nerves follow the blood vessels. The lymph nodes follow these fascial planes.
And when you know the rules,
You can predict the exceptions. You understand why a patient's heart might stop when you press on their throat, or why their voice changes after heart surgery.
Right.
And you know that if you see a lump right in the middle, that Delphian node, you need to look deeper, because the defense system has been breached. Anatomy is the map, but embryology and pathology are the legends that help you read it.
I love that. And here's a final thought for you to chew on, listener. We spent a lot of time talking about how the recurrent laryngeal nerve is shaped by blood vessels that literally disappear before we are even born.
The ghosts of the embryo.
Exactly. And it makes you wonder, if our nerves are taking these massive, inefficient detours because of vessels that don't exist anymore, what other ghosts of our development are hidden in our daily physiology? What other parts of us are shaped by structures that aren't even there?
That is a fascinating question. We're essentially a walking museum of our own history.
We certainly are. Thanks for taking this deep dive into the neck with us.
My pleasure.
See you next time.